come with me for a medical and health education outreach in the village of Otupo, Adoka in Benue State. This health education and medical outreach took place on the 5th and 6th of January 2024. So this is me at the village. We're trying to go and meet the pastors around just to join heads together for an evening program that we usually have. But mainly where I function was in the health education and the medical outreach. So I gave health education. This was day one. I gave health education on female hygiene, how to prevent some little illnesses, malaria. Then here we had a little screening for malaria, and we gave out drugs for the malaria, and also we checked their BP. We checked things like their BP, just to know, and for them to have an idea of what their blood pressure range is, and for them to be able to note and track their health. So here we're checking this woman's BP. A lot of people came for this. We had a number of almost 150. Day one, they were up to like 60 or so, 70. We have a record for this, by the way. They're up to like 70 or so. But day two was more massive. Like they brought people, and wow. Fortunately, I was the only medical person there. But I had my brothers and sisters in the Lord that assisted. They helped me. When I mean like they helped me, it wasn't easy, but I had all the help and support. They would always switch. They would always, I would tell them, do this, do that. I really thank God for their grace. And I think, this is day two. Day two, the people have not gathered yet. I had to wait. So you see, I was having a health education here, even here too, having some discussion. Some people will tell you something different from what you announce. Like we announced that we'll be having a free BP, what do they call it? Their blood pressure check. We'll be having malaria screening and malaria drugs. But you see all those things that we said, it was very far. You see some that had eye problem, glaucoma, they came that day, and I was like, God, how can I do this? I just had to refer them where possible, and the ones we were able to tackle, we tackled it. But most of the things that were announced was not, they just had medical outreach. They didn't care on the remaining information. News travels wide, so this opened my mind to see that there's some screening that we could also do, that we could also do for other health illnesses or disease. But here our resources, we're just running on the little resources we had and the little hands we had on ground. You could see that we had a lot of people, and this was a village setting, and malaria is something that is more prominent in the village. You see little babies, you see mothers, pregnant women, all exposed to malaria. I know how the village setting is. They normally go to the farm, they work themselves out, and we had a lot of talk about rest and how to control salt in their diet for those that are already diabetic and they are taking drugs. So it was a lot. I will not lie for you, because I enjoyed it. I will not lie. It has been a very impactful journey. This is like the second medical outreach that I have participated. The first one was the one I did, a health education, but it was not a medical outreach. But this is a medical outreach, and it was under Digging Deeper program. The name of the people that actually presented the program were Digging Deeper. So the medical outreach was done or held by me and my people, my team. So yes, and I know that in future we'll be having bigger and better health education and medical outreaches out there. This was a learning ground for me, because it pushed me to see more than just malaria. It pushed me to see that there are some things that we could do that could help people, and there were a lot of people that they didn't have anyone that could help them. Some came with their personal desires, some they knew that okay, this drug, they just wanted to have the drug, and it's good because you can keep it down for future purpose. Anyways, let me not talk too much. Thanks for watching. Thank you so much. Bye.